Let's just cut right to the chase. If you're a seasoned hospitalist, you already know your most precious resource isn't some fancy new diagnostic tool, it's your time. So today, we're focusing purely on Epic's new generative AI feature, Inpatient Insights. This explainer is going to be a totally no-fluff, highly practical guide to seamlessly integrating these AI summaries right into your daily workflow. We're getting straight to the points that actually matter, helping you understand the tools so you can spend less time doing chart biopsies and more time actually seeing your patients. Let's get into it.
Here's our quick roadmap for today. 1. The 3 AI summaries. 2. Updating your patient list. 3. Generating those summaries on rounds. And 4. Navigating the patient chart.
All right, moving right into part 1, the 3 AI summaries.
To help you quickly prep for that complex mix of patients you see every day, Epic gives you 3 specific look-back periods. Because, let's be real, you don't always need to read the entire history from day 1. Sometimes you just need to know what on earth happened overnight. So the AI generates 3 distinct summaries: a 48-hour look-back for notes, a 24-hour snapshot for recent events, and a full patient story overview for the whole admission.
First up is the 48-hour note summary by service. This one is absolutely perfect for quickly grasping recent clinical thinking. It synthesizes the updates documented by the care team, so you can see exactly what, say, the infectious disease consult or the night team was thinking without digging through endless notes.
Next, for your daily rounding, you've got the 24-hour recent events summary. This captures exactly what's changed clinically in the last day. It essentially filters out all the noise and highlights the medication shifts, new lab results, and vitals changes, basically giving you the highlight reel right before you walk into the room.
And finally, the patient story summary. This pulls together the patient's background, their hospital course, and current priorities. It's an absolute lifesaver when you're managing a new consult, getting a transfer, or just rotating onto a brand new service.
Okay, Section 2, updating your patient list.
To actually use these AI tools, you have to expose them in your workspace first. Don't worry, this is just a quick one-time setup. It takes literally 3 precise clicks to add the insights columns to your patient list. It's super straightforward, but let's walk through exactly where to click so you can knock this out the second you log in.
So, you'll just right-click your active patient list and hit Properties. Then, in the List Editor search box, simply type Insights to find and add the Combined Insights column. This single column cleanly packs all 3 summary types into one view, which keeps your screen nice and uncluttered.
Moving on to Section 3, generating summaries on rounds. The whole point here is minimizing clicks, right? So the absolute fastest way to pull this data is to just hover over that new Insights column you just added. When you hover, a pop-up appears, and you just click Generate Summary right there from the hover view. No clunky drop-downs, and best of all, no opening the chart and losing your spot on the list. It's built purely for speed. But what if you're sitting at the workstation at 7 a.m. and you want to prep your whole unit in one go? Well, Epic lets you bulk generate these summaries too. It's a really simple 3-step process. You select multiple patients, click the Insights submenu, and pick your summary type. Just look at your patient list toolbar, click the IP Insights submenu, select your patients, choose your time frame, and refresh your list. You can actually watch the AI build your summaries in the background while you go ahead and tackle other tasks. To really master this, you need to know what the interface is telling you at a glance. Epic uses a few very specific status icons in those columns. A question mark? That means a summary just hasn't been requested recently. A simple dash means the AI ran, but there's actually no new information to summarize, like no new notes have been written yet. You'll see a loading animation while it's actively generating, which takes about 8 to 10 seconds, though a massive patient story might take just a beat longer. And finally, you'll see these unique, colorful icons when a summary is complete and ready for you to view. In practice, having a populated list like this lets you instantly triage your attention. By just glancing at the Insights column, you immediately know which patients have fresh AI summaries ready to go and which ones have had 0 new clinical updates.
All right, our final stop, Section 4, navigating the patient chart.
So once you actually crack open a patient's chart, you don't have to go hunting for the stuff you generated earlier. Inside the chart, you'll find those exact same summaries neatly laid out right in your standard Provider Summary Report tabs. They live right alongside your vital graphs and active orders, which gives you a really comprehensive dashboard view before you even start typing.
Or, alternatively, these summaries live in the patient chart sidebar. Now, this is a massive workflow advantage. It lets you keep that AI synthesis open on the edge of your screen while you're actively typing your progress notes in the main window. No more annoying tab toggling.
Now, let's pause for a really important clinical caveat. Pragmatically speaking, AI is a powerful assistant, not your attending physician. Generative AI is summarizing existing documentation, sure, but it might accidentally omit details that you, the clinician, know are highly relevant, or it might just misinterpret complex nuances. So it goes without saying, you must always use your own clinical judgment and verify any information you're using to make actual clinical decisions.
The good news, Epic makes that verification process safe, fast, and incredibly easy. Look at the bottom of literally any AI summary, and you'll find an expandable References section. Click that, and it opens up hyperlinks mapping directly back to the exact progress note, procedure, or flowsheet the AI pulled the data from. So if a generated bullet point looks a little surprising or questionable, you're always just one click away from the primary source data to verify it yourself.
So there you have it. We've walked through the different AI tools, how to expose them on your list, how to generate them efficiently, and exactly where to find them when you're charting. These tools are already sitting right there in your workflow today. The only question left is, how quickly are you going to leverage them to get your time back? Thanks for hanging out with me for this explainer. Give that Insights column a spin on your next shift and see the difference for yourself.